Pneumonia. Pneumonia means accumulation of secretions and inflammatory cells in the alveolar spaces of lungs resulting in infection. The infectious organisms disturbance of gas exchange is responsible for clinical features. Organisms causing pneumonia. Streptococcus pneumoniae, that is the most common organism. Mycoplasma pneumoniae, seen in young adults. H. influenzae pneumoniae. Staphylococcus aureus, Legionella spp. Other organisms include the viral ones, that is measles, rickettsia, that is Coxiella burnetii, yeast and fungi, actinomycosis, protozoa, that is ant amoeba, histolica. Classification of pneumonia. The first one is based on anatomical region. So we have lobar pneumonia or alveolar pneumonia. Organism causes inflammatory exudates of many contiguous alveoli. Second one is interstitial pneumonia. Inflammation is seen in intra-alveolar septa. Third one, bronchopneumonia. Inflammation is seen in conducting airways, that is respiratory bronchioles and alveoli. Then we have based on etiology. First we have primary pneumonia. It is caused by pathogenic organism. Atypical pneumonia is caused by Mycoplasma, Legionella, Coxiella. Secondary pneumonia caused by pre-existing abnormality of the respiratory system. Example, aspiration of gastric contents, aspiration of pus, vomitus, ineffective coughing, bronchial obstruction. Suppurative pneumonia, seen in primary and secondary pneumonia with successful inactivation of organism. Complete resolution occurs and normal lung structures are restored. Then we have based on the mode of acquiring pneumonia. The first one is community acquired pneumonia, that is outside hospital, hospital acquired pneumonia, pneumonia in immunocompromised host, healthcare associated pneumonia. Clinical features of pneumonia: sudden onset of rigors, fever, pleuritic chest pain, productive cough, hemoptysis. Productive cough means cough which produces sputum. In atypical pneumonia, we see dry cough, myalgias, which is muscle pain, arthralgias, which is joint pain, headache, mental confusion, abdominal pain, and diarrhea, tachycardia, crepitations, increased respiratory rate, and greenish colored sputum. Investigations: total and differential leukocyte count, blood culture in hospitalized patients, respiratory secretions that are sent for microscopic examination, culture, sensitivity testing. In microscopic examination, we use Gram staining and Ziehl-Neelsen staining. Ideal sputum can be distinguished from saliva. Sputum specimen from the lower respiratory tract will have polymorphonuclear leukocytes and alveolar macrophages. If a patient is not able to expectorate, the following methods should be used. Induce sputum production by administration of the saline, transtracheal aspiration of secretions, transthoracic needle aspiration, open lung biopsy. Serological and antigen detection tests can be done. For example, pneumococcal antigen can be detected in serum, urine. Other investigations include radiological studies like chest radiography, oxygen saturation using the pulse oximeter, ABG analysis. Complications of pneumonia, parapneumonic effusion, meningitis, arthritis, endocarditis, pericarditis, peritonitis, empyema, ARDS, which is acute respiratory distress syndrome, septicemia, which means infections. In severe pneumonia, cavitation or abscess formation might occur. Other complications include pneumothorax. Mortality rate of the patient required for hospital admission increases. Indications for hospitalization is for patients who are over 65 years of age. Diabetes mellitus, renal failure, congenital heart failure, lung disease, alcoholism, malignancy, altered mental status. Treatment or management for pneumonia. Check ABC, that is airway, breathing, circulation. Treat shock with IV fluid, that is intravenous fluid. Treat hypoxia with oxygen inhalation or by mechanical ventilation. Treat pleuritic pain by giving analgesics, for example paracetamol. And lastly, antibiotics.